I want to move on now and talk about something, as I said, very close to my heart, and this is about consultants going on strike. A 48-hour strike, we're in the middle of this. This is by consultants. It's underway. And it's an extraordinary strike in many ways. It's the first time consultants have taken part in strike action since 2012. Now, I've spoken extensively about junior doctors, and I do believe junior doctors, and they do the bulk of the work, remember. So you're called a junior doctor until you become a consultant. They do the bulk of the work. It's a really tough gig, and I don't think they get paid enough, and I think they should be paid more. I'm not sure it should be 35%. We also need to look after their terms and conditions. But I am livid about these consultants because actually they earn good money. They're at the top of their tree. Now, let me just tell you that just in terms of the numbers, and this is really important, when they tell you they're not being paid enough, it ranges between 93,000 and 126,000. That is not the full story, though, because what they're not telling you is that they get about 30% more on top of that, and that is due to clinical excellence awards and bonuses as well. It is also worth pointing out they can also opt in to do private work. Now, also, when you look at the BMA, and these are the people who are forcing these strikes, in my humble opinion, on the public, they are pushing for a 35% pay increase, which is not realistic when the majority of people in this country aren't earning anything like this money. And I'll tell you what, if you said to most people, I'll pay you 120, 150,000 pounds, I should think they thought they'd won the lottery as a result of this. Now, Vishal Sharma, who is actually the committee chair, the consultants committee chair, is saying essentially the 35% makes up for lost income. What about the lost income of everyone who lost everything during COVID, when the government shut down their businesses, where lockdown prevented them from working? These doctors are out of touch, they are not reading the room, and they need to come back and negotiate. The independent pay review body said 6%, 35%, way off. And it's time the consultants actually took some of their own medicine. Joining me now, Martin Gower, former NHS Trust Chair. Good morning, Martin.
Good morning, David. I can feel your anger.
Well, look, I am really angry. Many of my friends are consultants, and they literally do disagree with me on pretty much everything I've just said. But the point is, I just do not understand how they can stand there and say we're not being paid enough, we need 35%, when you actually look at those figures. Those are good salaries.
They are. I mean, I don't have, in principle, a problem with the doctors being paid more. What I have a big problem with is them going on strike. When I very first joined the NHS as a non-executive director in a trust, and I'd come out of the private sector, one of the first things that confronted us was that the doctors intended to have a vote of no confidence in the chief executive. And I talked to a group of them, and frankly, I just said, look, this is like the student world. This isn't the real world. What's it going to achieve? And in many NHS trusts, the doctors live in a kind of silo of their own, and there is just not a good relationship between them and the management. Now, I think also it's fair to say that consultants, as well as looking after patients, they of course have to teach. They have to do, or they're expected to do research, particularly if they're going to get a clinical excellence award, and of course they have to supervise the junior doctors. So it is a bit of a hybrid role, and I think what they do is worth maybe being paid more. 35% is for the birds, but you know, I feel that striking, going on picket lines, waving placards, even for the junior doctors, I think it demeans their profession, to be honest. And I think there are other ways, if they feel that aggrieved, they should be dealing with this. So I don't quite maybe feel quite the anger that you do, but I do feel that there is an issue here of them just behaving in a way that you don't expect highly educated professional people to behave.
I agree with you totally. The sight of them wearing their jerseys, waving placards, I think is demeaning actually to the profession. I think there's another thing. The reason I'm so angry, and I have personal experience of this, as many people do, where people can't get treatment. We were told to protect the NHS, you know, to put this ring of steel around everything. The fact is that people were there, they believed and trusted the NHS. They didn't get treatment. Our cancer survival rates are woeful in this country. Benedict said to me earlier it's about actually putting more money into the NHS. I just don't agree. When you look at the percentage of GDP that goes in, we actually spend a lot on it. Our outcomes are appalling. But you make a brilliant point here about the unionisation. Now, the British Medical Association, I've resigned from them because I didn't like what they were doing. But just in terms of this, what on earth are they doing in terms of optics, siding with Mick Lynch, who wants to force a change of government? Is this really about actually patient care, or isn't this deeply, deeply political?
David, it's deeply political. It has nothing to do with patient care. I mean, my own brother is a retired consultant nephrologist from a London teaching hospital. If he had a patient in Charing Cross Hospital where he worked who was really, really struggling and suffering in the night, he'd get a phone call and he'd hot-foot it back from where he lived in Surrey back to the hospital. You know, the attitude of people at the moment is terrible. It's like during lockdown, I feel the work ethic kind of disappeared from society. And these situations, look, the doctors don't always work in a great culture in the NHS, and it's a question of leadership, isn't it? I chaired a panel where we were appointing a new medical director in the NHS trust that I was chairing, and you could divide the candidates into two. There were those who thought the medical director was there to represent the doctors, and there were those who thought they were there to lead the doctors. And I think the leadership issue is a big one here. Are they being led by the people they work with, their peers, the other doctors they work with, or are they being led by the BMA, who is clearly a left-wing union, sort of Arthur Scargill-esque in its way, who are there to try and overthrow the government? In fact, I don't know whether they're in competition with Mick Lynch or whether they're actually in collaboration with him in this desire to look at what we did. We got rid of this awful government.
So the last thing, I suppose, is that it's completely undermining people's faith in the NHS. It's our NHS. We keep being told that. We pay for it. Now, if you cannot get treatment, if we've one of those 7.4 million people waiting for elective procedures, you can't get an ambulance, you can't get admitted, you can't have your cancer treated, then ultimately my biggest concern is actually, what is the point of the NHS? Is this the beginning of the end, where people say, I'm not paying for this because, quite frankly, it's rubbish?
David, I think there's a real risk of that. And can I just add to your point about the 7.4 million patients who are waiting for procedures? I also feel for the people around them, for husbands and wives and children and parents, their loved ones, the ones they depend on, because actually the people who are suffering, maybe some suffering with physical health, others suffering with great anxiety and stress over what's happening to their husband or their wife. You know, this is maybe as many as 15, 20 million people who are impacted by this. And it is a disaster. And the BMA need to be named for the people who are leading these doctors in the wrong direction. I'm just a bit sad that it seems too easy to lead them in that direction. The NHS, maybe there will be a drift to the private sector. I don't personally, as you know, in terms of elective care, I'm not actually bothered by that. But in fact, they're doing damage to the NHS. What happened to the coal mines when the miners went on strike? Eventually, most of them closed. What happened to our car industry? Most of it went. And so they are trying to destroy the very thing that they claim to be trying to support.
Martin, very good to talk to you. Thank you for your time. Martin Gower, their former NHS Trust Chair.